6 symptoms of pancreatic cancer that will shock you. Welcome to our video on recognizing the early warning signs of pancreatic cancer. This illness is a significant challenge in the field of oncology, standing as the third leading cause of cancer-related deaths in the United States. The pancreas, a vital organ located deep within the abdomen, plays an essential role in both digestion and blood sugar regulation. Unfortunately, its deep-seated location makes early detection of pancreatic cancer especially difficult. Most patients don't show noticeable symptoms until the disease has reached an advanced stage, which heavily contributes to its bleak prognosis. Despite these challenges, there's hope. By understanding and identifying subtle early warning signs, we can enhance the chances of catching this disease early. In this video, we'll explore these signs, shedding light on their importance and how they relate to your overall health. From jaundice to changes in digestion, we'll break down the symptoms and explain how they tie back to pancreatic function. Additionally, we'll discuss risk factors that may increase the likelihood of developing this condition. Ready to gain critical health insights? Make sure to like this video, subscribe to our channel, and let's get started. Please note that the information we're about to share is grounded in medical research and follows guidelines from leading cancer organizations. One of the earliest and most noticeable signs of pancreatic cancer is jaundice, a condition that causes yellowing of the skin and the whites of the eyes. This occurs due to a buildup of bilirubin, a yellow-brown substance formed when the liver breaks down old red blood cells. Under normal circumstances, bilirubin travels through the bile duct and is eventually excreted by the body. However, pancreatic tumors can block this pathway, causing bilirubin to accumulate in the bloodstream and resulting in the characteristic yellow discoloration. It's important to understand that jaundice can stem from various conditions, such as hepatitis or gallstones, when it is linked to pancreatic cancer. However, it is often accompanied by other symptoms that we'll address further. While jaundice doesn't automatically signify cancer, it serves as an indication that something may be amiss in your digestive system. Recognizing this warning sign early can lead to timely intervention and potentially improve treatment outcomes. Don't ignore this visible change. It might be your body, and specifically your pancreas, trying to communicate an important message. Next, persistent nausea and vomiting. These symptoms can be early warning signs of pancreatic cancer, particularly when they occur without an obvious cause. They often result from the tumor's impact on the digestive system. As pancreatic tumors grow, they may exert pressure on the stomach or small intestine, disrupting normal digestion. This pressure can lead to a partial blockage in the digestive tract, which in turn causes a feeling of fullness, nausea, and occasional vomiting. It's crucial to distinguish between occasional stomach upset and persistent symptoms. While occasional nausea is common and typically harmless, the nausea and vomiting associated with pancreatic cancer are usually ongoing and may progressively worsen. These issues might become especially pronounced after consuming fatty or heavy meals. Additionally, you might experience a sudden loss of appetite or feel full very quickly when eating, both of which can contribute to unintended weight loss. Pay attention to patterns in your digestive issues. If nausea and vomiting occur frequently, particularly if they are accompanied by other unusual symptoms, it is important to seek advice from your healthcare provider without delay. The next symptom to be aware of is persistent, unexplained itchy skin, also known as pruritus. This often overlooked condition is sometimes dismissed as a minor issue or attributed to more common causes, but it can carry significant implications. Itching associated with pancreatic cancer is typically widespread, affecting the body as a whole rather than being localized to a specific area. Many describe it as intense, unrelenting, and resistant to standard remedies like moisturizers or over-the-counter anti-itch creams. This type of itching is thought to result from the buildup of bile salts in the skin. When pancreatic cancer blocks the bile duct, bile flow is disrupted, causing these salts to accumulate in the bloodstream and eventually in the skin. Notably, itching may surface before more apparent symptoms, such as jaundice. While it can occur anywhere on the body, it is often most pronounced on the palms of the hands or the soles of the feet. If you are dealing with persistent, unexplained itching that does not respond to usual treatments, take note. Though this symptom might stem from benign causes like dry skin or allergies, you should inform your doctor, particularly if it coincides with other unusual or concerning symptoms. Continuing with point number 4, abdominal pain. Discomfort in the abdominal area, especially in the upper abdomen, can be an early indicator of pancreatic cancer. Unlike typical stomach issues, this pain often has unique characteristics. It is generally described as a dull, aching sensation that may extend to the back. The discomfort tends to worsen when lying down and can improve when leaning forward, which is linked to the tumor pressing against nearby organs and nerves. As the tumor grows, the pain may intensify and become more continuous. Some individuals report it as a gnawing sensation that particularly worsens after eating fatty foods. This occurs because the pancreas releases digestive enzymes post-meal, and the presence of a tumor can amplify this discomfort. While abdominal pain is a common symptom for a wide range of conditions, including indigestion and pancreatitis, persistent or severe pain, especially when accompanied by unusual symptoms, should not be overlooked. Seeking medical evaluation in such cases is essential. Moving on to number 5, a less obvious yet equally significant warning sign, the sudden onset of diabetes. Diabetes, particularly when it occurs in individuals with no prior history of the condition, can sometimes serve as an early indicator of pancreatic cancer. This connection arises from the pancreas's dual role in the body, producing digestive enzymes and regulating blood sugar through hormones like insulin. When pancreatic cancer develops, it may disrupt the organ's ability to produce insulin efficiently. This interference can trigger a rapid onset of diabetes symptoms, such as increased thirst, frequent urination, blurred vision, and unexplained weight loss. It's crucial to distinguish this form of diabetes from the more gradual development of type 2 diabetes, which is often linked to lifestyle factors. In contrast, diabetes associated with pancreatic cancer tends to emerge suddenly and progress quickly. If you're diagnosed with diabetes, especially if it develops abruptly and without clear risk factors, it's essential to take notice. While new-onset diabetes is usually caused by other factors, discussing the possibility of additional testing with your doctor can be a prudent step. Lastly, number 6 highlights changes in the color and consistency of stool and urine, which can occur due to the tumor's effect on the biliary system and the pancreas's digestive functions. When pancreatic cancer blocks the bile duct, noticeable changes may appear, such as darker urine with a brown or amber hue. This change happens because of increased bilirubin levels in the bloodstream. In contrast, stool may become lighter or clay-colored, as bile, responsible for stool's brown color, can no longer reach the intestines due to the obstruction. Additionally, pancreatic cancer can impair the body's ability to digest fats effectively. This may lead to stool that appears oily, floats in water, or has an unusually foul odor. Known as steatorrhea, this condition results from undigested fats passing through the digestive system. While these changes in stool and urine can stem from various factors like diet or medication, persistent alterations should not be ignored and may require medical attention. Understanding the factors that contribute to pancreatic cancer risk can help pinpoint individuals who might benefit from closer observation. While this disease can develop in anyone, certain elements significantly heighten the likelihood of its occurrence. 1. Genetics. Genetics play a pivotal role. Individuals with a family history of pancreatic cancer or hereditary genetic syndromes carry an elevated risk. Specific mutations, such as those in the BRCA1 and BRCA2 genes, are closely linked to a higher susceptibility to this cancer. 2. Age. Age is another critical factor. The likelihood of developing pancreatic cancer rises as people grow older, with the majority of cases being diagnosed in individuals over 65. This underscores the need for greater awareness and vigilance as one ages. 3. Smoking. Smoking represents a significant modifiable risk factor. Smokers face a considerably higher chance of developing pancreatic cancer compared to non-smokers. Fortunately, this risk diminishes after quitting, highlighting the importance of smoking cessation for long-term health. 4. Chronic conditions. Certain chronic conditions also play a role. For instance, long-standing diabetes, particularly type 2, has been linked to an increased incidence of pancreatic cancer. Similarly, individuals with chronic pancreatitis are at heightened risk. 5. Obesity and lifestyle. Obesity and a sedentary lifestyle further contribute to an elevated pancreatic cancer risk. Adopting a healthy lifestyle, marked by balanced nutrition and regular physical activity, can significantly reduce this likelihood. 6. Chemical exposure. Prolonged exposure to specific chemicals, especially in workplaces such as metalworking industries, is also associated with an increased risk. Implementing robust workplace safety measures is essential for minimizing these dangers. By recognizing these risk factors, one can take informed steps to lower their risk or seek earlier interventions when needed. Experiencing one or more of these symptoms does not automatically mean you have pancreatic cancer, as many of them can be attributed to less serious conditions. If you found this information helpful, consider liking this video and subscribing to our channel. We share more health-related content that could potentially save lives. Be sure to explore our other videos featured on the screen. Your support enables us to reach more people with vital health information.